In our 78th season, the Palm Beach Civic Association expands its communication outreach with a state-of-the-art television studio. 33480, the zip code for the beautiful island of Palm Beach. Our goal? To bring you in-depth interviews of the most colorful and knowledgeable personalities on the island. And now, our host.
I'm Christina Nicholson in Studio 33480, where we bring you in-depth interviews with some of the finest people here in Palm Beach Island. And today I have with me Healthcare Committee Chair Judy Goodman. Judy, thanks for being with me today.
It's a pleasure, Christina. The new studio looks fantastic. It's very intimate, and it looks like you're going to have some wonderful interviews here.
Thank you. And you are one of our first interviews. Super excited to chat with you. Just left a Healthcare Committee meeting. There was a lot of talk specifically about the cost of prescription drugs and what the committee plans to do to help other people make them more affordable. So talk to me a little bit about that.
We have a fantastic committee, and this was their first time for convening since we dispersed last May, and there were many things that had gone on here in Palm Beach over the summer where they missed the hike in the positivity rate for COVID, and now luckily we're on the decline. And with that behind us, we're moving forward into the season, and we heard a variety of different things. The town, of course, is planning for a telehealth program, which is very exciting, and we're going to hear more about that next month. But the one committee that you referenced, which has been meeting all summer, is a committee that is concerned about the cost of pharmaceuticals, both from the consumer perspective and just in the nature of the markups that don't seem to be able to be pierced by our federal system in any way. So what they're planning on doing is bringing a speakers event in which they would bring some of the public benefit corporations that are active in this space in bringing manufacturing, generic drug manufacturing, to the hospital system and hopefully the insurance system in the future so that they can bring down the cost of drugs, at least those that can be manufactured more cheaply. That opens up a variety of different topics, whether it's buying drugs from Canada or buying taking out just a manufacturing of drugs with just a cost-plus kind of approach like Mark Cuban has been proposing, or the actual generic manufacturing of highly priced or orphan drugs that are difficult to obtain, both for people that have unusual or rare diseases or for very expensive products, whether it's for cancer or autoimmune disease or even insulin in this day and age. And then you also have the topic of whether there are some discount purchasing schemes like 340B, which is popular for nonprofit and Medicaid patients that buy from the federal government through the public health system, as does federally qualified health clinics. So all of these deliverers have a story to tell, and our committee is going to work on trying to narrow it down so that they can have a very palatable and popular program sometime here in the season in Palm Beach. Now, another one of our interesting committees is the committee that is focused on trying to explain to the people of Palm Beach what some of the changes in the macro health system delivery are here. In particular, we no longer have certificate of need here in the state of Florida, which means that many hospitals are opening up just based on zoning and may not have to prove whether they really meet a community need or a competitive need to others, and they're, for the most part, skimming off the paying customer without having to do the things like emergency rooms and things that are community serving and of community benefit. And so that opens up a bunch of questions as to what that might mean if you take away the subsidies of hospitals by only leaving them with the poor and people who can't pay, and you take away all the paying customers that usually pay for that, that has lots of implications in delivery of service because they can't probably then have the ability to hire nurses and staff facilities properly with the kind of expertise and talent that we are used to when we're in an emergency. So one of our committees is going to be working on the concept of what type of panel might be effective in bringing that type of information to our very sophisticated Palm Beach market. So we've got lots going on in addition to our regular programs that we have already initiated, like File of Life and some of the things that are so popular in our community. So we're really busy, and we're looking forward to a robust season. And I'm just very grateful that I have so many interested people on our committee that have volunteering their time and effort for this kind of education for our town.
Finding solutions in healthcare is a big battle. On the committee, there are some people who are very well versed in the industry. You have a great group of people to find these solutions and tackle these problems.
We do. We have doctors on the committee. We have registered nurses, advanced practice nurses. We also have a variety of different health policy experts, and we have some nonprofit chairmen in the health services arena that are very well versed in some of these delivery issues and problems and obstacles. So it's a really rich community full of lots of intelligence and lots of energy. So we're very blessed by all that.
If anybody can do it, it's the healthcare committee.
Well, we like to say that about ourselves. So I'm glad that you're noticing.
Thank you, Judy. That is it for here in Studio 33480. We will see you next time when we speak with another guest.
Studio 33480 is brought to you by the Palm Beach Civic Association. Please give us your thoughts about our programming and how we can best serve our members and residents.